patients with cold. So, you notice this balloon, no? When you inflate this, there is what you call the calf pressure manometer that we need to inflate and deflate. The normal is from 20 to 30. So it's green. Anything beyond the green, it's red. It's this will cause to burst or to inflate, overinflate or deflated. So it is kept. This one with purple. This is used for patients who are weaned to, and then later on be removed. No, this is the purple catheter. So it is inserted through the. This is surgical insertion of this tracheostomy tube. We call it tracheostomy. So I will just keep it to Edgar. So we will do the tracheostomy here. Actually, there is a easy tie for this one. I will bring next time. Because it's so good. I brought this. The size is big. So this size is 8.5. So it's bigger. The size is up to 6, 6.5, 7, 7.5. Okay. Yeah. Let's presume that's inside. So there is Velcro tie, no? You don't leave like this. Otherwise, the patient will cut, it will go. So there is another tie for that. If that tie is not around, so we can use this tie. Okay? So it's two to change. For us, we have a policy. We need to change the tie once it is soiled, or otherwise if every 24 hours when you are giving the bath, okay, because this will get wet. So if the patient is for weaning, we used to keep this, cover this with the purple cap. Usually in the daytime only, because in the nighttime the patient needs to.
What is the purpose for that?
The tracheostomy. If patient is bedridden, you notice some patients in the, I think you
No, me is.
here in the oral, no? If patient cannot breathe by himself, so he has to be kept with that tube on the orally. We call that endotracheal tube, and then connected with the ventilator. Okay. Then if already 1 month the patient is with the endotracheal and still cannot breathe independently, it will be transferred. The oral can be transferred to the tracheal through surgical. So we call that tracheostomy. So this one, there is a manometer to inflate. Otherwise, get a syringe and then you need to inflate this one. I think I have a syringe. So when that, no, that is the
Kasi gusto na kayo sa akin niya. NGT. Pero pag wala din, ano na siya eh. Ilang months na ba ako dito? 10 months na. Ganito ba? Ano dito? Nag-ano siya eh.
may syringe. Syringe, okay. You should be familiar with the items, the medical syringe, yung ringbilya. With syringe, ringbilya. Okay, we used to have 10 cc. Yung sa ano? Ito, dyan siguro. Ay, okay. So, this is what you call The syringe.
Yes.
Syringe. We have from 1 ml, 2 ml, 3 ml, 4 ml, up to 50 or 60 ml. So we used to, some syringes doesn't have a needle because sometimes the needle is not being used. So, and needles are separated. Sometimes it comes only like that. Then we need to get air, no? 10 ml, and then we need to inflate. See, it's inflating. Okay? Then we need to close. So, it should be within the 20 to 30 range. When you use the, otherwise get the 10 and inflate all the air. And then the other one, which is the blue one with Velcro, you need to secure it there so that, or otherwise, I feel like, because if this one is being with sharp, no, this causes the deflation. Then if the patient is already went for the cannulation, where remove is speaking, want to talk, you need to put this cover. Otherwise, we have what we call the thermovent. This one, thermovent. Then it will be kept there. Okay. But the patient is, if you hear some audible sound, different, you know, the different lung sounds, crackles, hoarse and fart crackles, wheezing, the patient needs to suction with cough. So you need to suction. So you need to remove. Suctioning is a sterile way. So I will show you how to suction with that. We'll just skip Edgar all the tomis, no, the tubes. Then we'll keep this one. We'll be needing this later on. Pakalat tayo. This one to keep that back. Who is doing the sponge? Now we will use it. This one.
Catheter?
Meron akong ano dito. Parang powder.
No, don't worry.
To avoid rashes.
May isa, di ba? Nung nakaraan.
Damage ng pampers.
I should not show you this. But I will
Kasha
show.
tayo na nila. And ipot. Ipot.
Opo.
Lagyan niya tayong damit niya.
Ipo.
Hindi, nakadala. Ay, wait. So, this is the, for patients who cannot pass urine and the bladder is distended, doctors will, you ask doctors for Foley's catheter. You need. For patient with strict intake and output monitoring, you have to put a catheter on the patient. Or patients who have, who are stroke patients, that the urinary is affected because of the sensation, the derangement in the sensation of the patient, that the brain cannot signal that the bladder is full. Then the capacity of the urinary bladder is, who is the urology? No, the urology system. Who was urinary system capacity? Forgot?
Yes, ma'am. I forgot.
500. You should not forget that. Why? So that within your shift, you know how much urine output of your patient. 30 ml per hour. The patient, the normal urine output is 30 ml per hour. If your shift is 12 hours and you have only 100, is that normal? No, especially the color of your patient's urine is not normal. The normal color is yellow amber. Yellow, clear yellow straw. Then there is amber, the orange one. It's like slight dehydrated. Then there is a red flecks or bloody. And there is tea colored also. There's the problem for that. So you should be keen in observing the urine output of your patient. Okay. So if the patient, usually the patient is being kept with the Foley's catheter for either male or female. Okay. So, granting that this catheter, you insert this one, you need to put, Justine was showing me the catheter set. Okay. This is the catheter care set. There's already, because it's a sterile procedure, there is already a lubricant there. Okay. So, and there is sterile gloves. So, you need somebody to put the catheter. Okay. Like, since it's a sterile area, you need to put all the sterile things there, pour it there, and then there is one area there. So you should have a sterile gloves. So you just keep it like that. Okay? Then, there's already the povidone iodine. This is betadine. You need to clean. How to clean? One stroke only. Start from there, like that. Then, again. Then, to disinfect. Okay? It's inside this one. And then, there is a lubricant. This one is already open, but the closed one is if you offer this one, you need to just offer the tip and then pull. Just pull. And then the plastic is being left there. Do not remove. Okay? Then with your clean sterile gloves, you put on somebody to put on this lubricant here, and then you'll just put like that. But this one is sterile. And then you will start putting it there, insert. No? Or what is the evidence that you are already in place? If there is urine output. So, this urinary catheter will get inside up to this until until an output, you will receive an output and then connect it with this urinary valve. Okay. Urinary valve just, if this, sometimes this one is difficult to insert, just get this this wipe to wet it little bit, and then it's easy to clamp it, to connect it. So this one is sterile bottle to correct the urine. For example, I told you before that just only the tip will open, and then slowly you will remove the plastic because the plastic somehow will receive the urine output. Otherwise, you kick this one, and then to get a clean cut urine, you need to open and then this one, get urine sample for urine culture and urinalysis. But if the patient is already with catheter and then the doctor ordered you to collect some urine, there is a port here, okay? You need to alcoholize it, disinfect, and then with the needle with the syringe, you need to, where is the syringe? Lower lock. See, this is, do you remove the needle? Delicado. Okay. You just connect this one. Disinfect it first, and then you need to, sometimes this syringe is not designed. So you need the needle. You need the needle, and then urine will be there. You disinfect this with alcohol, inject, and then aspirate. And then you remove the needle and put it in the sterile container. Why I am telling you this? Because you will be collecting. Sometimes doctor will order you collect urine from the patient. So
Mom,
this,
excuse me, I have a question. We will insert this one without anesthesia or
no
is it
need.
because
Lidocaine,
this is not pain?
it's not painful. It's only an opening. Sometimes if the patient has an obstruction there is pain. Otherwise, I told you there's a lubricant. This is a normal lubricant. Otherwise, we will inject lidocaine gel inside first and then we will. Okay, it's a good question. So, remember this guys, this is the bag. This is the ordinary bag. There is an hourly bag used in the ICU. You take note of this one. Where is the close and open? What do you think? Is this close or open?
Close.
Close, why?
We will pull this one to be open.
Okay. The other one to see if it is closed is look at that.
Yeah.
So it's closed. No. If you open this one,
It will go like this.
you
Now
can
open.
go. So make sure that it's closed. Otherwise, there's no urine output of the patient. Only to find out that's all under the
floor.
So always hang this one without touching the floor. No? So it's designed like that. So we will keep. And then nagkaroon punong-punong tayo ng then there are areas there to hang. Should be down, no? So that it will drain easily. So to avoid pulling, first after inserting and urine came out, then we need 30 ml of water. You need to inject there to urine. You notice there is a balloon there. Yeah, there is a balloon there. If you inflate 30 ml, or the Foley's catheter says otherwise, it was erased already. It usually it's written there, inflate 30 ml of water. So, I'm telling you this so that you know, you will not insert, but you know what are the things to prepare. Okay. So this one is size 16. It depends on the color. This one is size 16. The size 14 is green one, green tip. The 18 is red. Yellow is 20. Okay.
My color code.
Yeah. So there's color coding like the
Cannula.
So we have also a leg strap here that to avoid to avoid pulling. So the leg strap should be attached there. Okay. Can what this so that next time we not kaya niya right tracheostomy tie, right? What we need? Tracheostomy tie, then leg strap. Leg tie. So that next time I will bring. So this bag is also dated to be changed every week if it's not dirty. Otherwise, if it's dirty, you need to change. And this one, it depends on type. There is silicone type until there's no leakage or fever from patient that connotes infection, no need to change it. Or leakage, you need to remove. Or if patient is conscious and can ask for a urinal, urinal that is a calibration, you can monitor the intake and output of the patient. Otherwise, if the patient is unconscious, you cannot tell that you will pass urine, so you need to put the Foley's catheter. Now, it's not all the time that you put Foley's catheter. For male, it's easy to put the condom catheter, but for female, Foley's catheter. You cannot put. Now we will put this. You done something. Actually, the other mannequin has port here for the PEG. You know, the PEG for the percutaneous endoscopic gastroscopy, directly for feeding. So, granting this is, we will put this as the PEG because we will be feeding. So, there's no hole. Only this area. So, we will put this as in. This is in the. If you have patient, no, bedridden patient, and is not eating, only eating through tube, it's better for you to suggest PEG because this is direct in the tummy. Rather than NGT, that there's the risk for aspiration. Okay. So granting, we have an NGT. If the patient is already more than 1 month of feeding the NGT and there's no way for him to eat orally, then you have to request for PEG. That is more safe for the patient. There is one tube here. We will put as NGT. So guys, we have sources of, so this is PEG. This is urinary catheter, but we'll put it as PEG. We will go first to the urinary catheter. For patient who is passing and frequently and you are bothered of changing the diaper, is conscious, if he's unconscious or even conscious but you keep on changing the diaper, it's advisable to put the patient on condom catheter. You know, this is condom catheter. I know I have a lot of condom catheter here. And also a lot of dressing material. See, you know, I went to look for gloves. Aisha, where's the blue gloves? Blue gloves. See, this one, take note of the, I have already. Take note of the equipment. I will bring one by one and I will tell you what is this. Take note of this stuff. Saan yung blue?
This one.
You know why I use blue? When you insert condom catheter, do not use this gloves because it will stick. It will still stick on that. So, choose this blue. Oh, nice one. Guys, I suggest that when you work with, you need to have trash bin beside you so that you will not be makalat like me. This one. That everything has to dustbin. So this is the condom catheter. It depends on the size of the penis. This is the smallest size, the 30. There is 35 also. So I think we did 35 for this one. This
We
one
do.
is
We do.
30.
Small.
All 30. All small ba?
Sayang.
Small. Okay, we'll try. Okay, this is easy to see. Guys, I'm teaching you how to apply condom catheter because some nurses even that we are interviewing, we have this condom and we have the applicator, the sticker. Okay, see? This is a sticker. You know, that's why I changed because it will stick on that. Otherwise, you will see. You have to put. Be considerate if the patient has a lot of hair there. Imagine pulling it with the hair. It's really ouch. Okay, so you have to shave and then put that one. And then some ethics are not erecting like this. So you need to hold from the bone and then you need to insert.
Support.
Oh, this one is already the
This will help to hold
attach to hold the
Condom.
the condom
condom
catheter.
catheter.
Then you need to reinforce it with
So this is better. For that one.
Yeah. It depends. If the patient cannot pass urine by itself, that Cox catheter is recommended. Otherwise, then you need to secure it with this micropore. So you need to, but do not strangulate. See, I will teach you how to keep, because imagine if you do like that, okay, it would be very difficult for you to remove. Then even the skin of the patient. Once you remove the condom, skin of patient will also be there. So always make intense, so that it's easy for you to just leave. Otherwise, you keep on holding. Okay. So this is how to apply the condom catheter, and then you
Insert
the bag.
Insert na siya.
Put the bag. See, you see, it's difficult to insert, but with where is the wipes? You know, you just put wipes to grease it. Then see, it's difficult to insert, but once you wet it with the wipes, see how it is being inserted. Okay, just easy. Okay, then you need to put the strap, no? So that it will not be pulled out. Sometimes some patients are especially conscious one. They pretend to be unconscious. Then they will pull, especially if the nurse assigned is a female, no? They want to them that. So be careful with those kinds of patients. Okay? Then what else is attached to the patient? I will show you. This one is already the PEG. There should be a tube there, no? To cover it. I saw something before. That one. Anyway. So I will show you different types of oxygen source. So this is what you call the thermal humidifier. If the patient needs oxygen and he is on tracheostomy, no need to put oxygen here or nasal cannula. You just connect this one. This is what you call the thermal humidifier. Just connect it like that. Okay, and then connect it with the oxygen source. Let's say 1 liter, 2 liters, or so we call this one.
Thermal modifier.
This one, TPs or thermal humidifier. Then this is the tracheostomy tube catheter used to suction. So there is a rule. You check the size of the tube. This one is 8.5. So the catheter you use should not be more than double. So what is the double of 8.5? 17. So there's no 17. The largest is 16 only. So this one is already 16. Okay, so you can use this one. So size 14 is green again. Size 18 is red. And then size 12 is white only. So when the patient is coughing, he needs to be tracheostomy suction. Because this is my table. Okay. So if you will, bakit yung pinag-aalis dito? Kaya na ako pumunta dito.